start. We're going to look at introduction to health financing. So we are going to look at we are going to have a series of lectures on this topic on health financing. Um, so the first one is this one where we need to cover the definition of health financing, the functions of health financing, the different methods of healthcare financing, and then the different policies that guide resource allocation, and generally the benefits of healthcare financing. So when we talk about healthcare financing or health financing, or what we call health system financing, these are basically the same things. We are looking at how to mobilize financial resources, manage them, and then allocate them to different functions, or we allocate them to different items that we need in order to have health services delivered. So if you remember, it is one of the building blocks of health system. The health system is basically all the organizations, the institutions, the activities that that are interrelated to make sure that health services are delivered to the population or individuals. So the health system has health financing as one of the blocks. It has infrastructure. It has health information systems. It has pharmaceuticals and medicine, essential medicines, and it has human resource, and then it has governance. Okay, so health financing is one of the building blocks of the health system. So basically, we are looking at how resources are mobilized, and then how we manage these resources and allocate them to make sure that the population receives the services that they need. Okay, so that is very, very important in understanding health systems, how health systems work. Without money or without funds, it is not possible to provide services that people need. So health financing is very important because it is through the resources that we put into the health system that we can be able to improve the overall performance of the health system. With this, I mean that, see, the goal of the health system is to make sure that the appropriate services, healthcare services, are provided to the people at a cost that is manageable, that is sustainable. And if that happens, it means the output, which is basically like the outcomes, like of us using these resources, the things that we can see improve are what we call the health outcomes. So we can judge whether a health system is performing well depending on the health outcomes. Okay, so if we have a proper sustainable financing system, then it is possible that the health system will achieve its performance goals, and therefore the health outcomes will be improved. That means that different people can access healthcare services that they need in order for them to have improved the health outcomes. So this is an issue to do with distribution. And then the other issue, which is to do with responsiveness. You see, the health system has it is very dynamic. You will have changes that happen maybe in the disease pattern, maybe in technology, maybe in finances. the health system needs to adjust to these dynamics in order to 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 tackle any health problems that can happen. That is what we call responsiveness. The system should be responsive to the health needs of the population. So it should a proper health system should be continuously surveilling to see what is happening in terms of the diseases, in terms of the potential risk factors, and how to respond to these diseases and risk factors that are happening. And then the third one, which is that it is a proper financing system allows fairness to happen. With fairness, we say that people should contribute fairly to either the benefits and also the costs that are associated with having improved health care. Okay, so we shall look at this later on when we look at issues to do with equity. But basically, we want people to contribute resources to the health system, to the health financing, such that people can receive services. The taxes that you pay, you are basically contributing to health financing, because it's from that budget that of the national budget that you'll be able to finance health services in the country. So everyone pays taxes. The payment of taxes should be fair, in that those who have more money pay more taxes, and those who have less money pay less taxes. It is a fair kind of mechanism. So if you have a health financing system, it should be a fair financing system. And then the other aspect is what we call efficiency, which is that you need to use minimal resources to have optimal outcomes, which are basically optimal health outcomes. So that you don't have to misuse resources, and then you get less in terms of health outcomes. So that is the other objective of health financing. You don't want to misuse resources, because resources are minimal. So out of the limited resources, you want to have maximum output, which is basically in terms of health outcomes. So when we talk about health financing, we are looking at three major aspects. One is how we collect the revenue that we shall use to finance the health system. So that is revenue mobilization and collection. The second is what we call risk pooling, which is that we want to collect money from the population such that anyone who falls sick can pick part of that money and then get treated, or part of that money can be used to treat any person. This is very important because it protects you from spending a lot of money when you become sick. Okay, so for example, if you have five people who are contributing resources every month. Okay, they are contributing, let us say 5,000. So that means for 5 people, that is 25,000 in a month. So in 10 months, that is 250,000. And then therefore, if any of those 5 people fall sick, they can use part of that money to get treated, and then they will not feel the burden of being treated because they are fallen sick. So that is how important resource pooling is. It prevents you from Bench, you please, you need to mute, huh? Yeah, so it prevents you from financial losses because of ill health. And then the third one is how do you allocate resources? This is to say, you have different areas in the health sector that you can spend financial resources on. Remember, we have different categories of healthcare services. We have primary healthcare services, secondary healthcare services, we have tertiary healthcare services, and then we have what we call quaternary healthcare services. Okay, so all these services still need you to finance them. So how do you decide on how much you allocate to any of those services? Okay, so there are many questions that you have to answer here. But the two major concepts related to resource allocation is you want to ensure that you're not leaving anyone behind. That is an issue of equity. And then the other question is what we call efficiency. The financial resources that you invest should give you the results that you expect. If you are putting in a lot of resources and you're not getting the optimum outcome, then that is inefficiency. So the two concepts of equity and efficiency are very important in resource allocation, and we'll look at this later on. Okay, so the two concepts, equity and efficiency, I've actually explained them. So we look at the third one, which is sustainability. Okay, you need to have a stable long-term financing framework that can withstand any economic and demographic changes. Okay, this is to say that you don't want to have a financing system which cannot be responsive to any demographic changes. And the changes may not only be demographic, but the changes may also be epidemiological changes that happen in the disease pattern. Okay, someone is also joining again with Bentu. I will block you and you will not attend this session. You're just disrupting us. When you repeat that, I will just block you. Okay, so sustainability is very, very important because it allows the health system to be responsive to any changes that happen, whether economic or demographic or epidemiological. Okay, so it should be one that that cannot easily break down in case of any changes in the system. So, for example, I don't know if we can say that the health financing system in South Sudan is sustainable. Can we say that? Can we say that the health system financing system or mechanism in South Sudan is sustainable, and why? Uh-huh. Yes, go ahead.
Before I would like to comment on the sustainability of the financing system in the country,
Mm.
I would like someone if can be there to help me
Mm.
to actually be able to help me on the financing system that we have as South Sudanese,
Mm.
at least some of them. because I honestly I'm not sure of the financing system apart from the taxes from the employees.
All right.
Other means I don't know really.
Okay. Yes, in South Sudan, our financing mechanism is basically we get funds from NGOs, donors. Then we have the taxes, what we can call the general taxes that we generate, and then we also have people who are paying out of their pockets, what we call out of pocket payments. So, for example, when you get sick, when you go to the hospital, uh, the following can happen. One, if you go to the NGO hospital, it is free. Or if you go to a non-profit, I mean what you call faith-based organization, Don Bosco, for example, usually the services are free or they are subsidized. You can go to a private hospital and then you pay for yourself, that is out of pocket. Or if you are insured by your organization, your NGO or any other organization, then the insurance company takes care of that. So those are the major financing mechanisms in South Sudan. So now the question comes back: do we have a sustainable financing mechanism in the country? Yes.
Well, thank you so much. Uh, Theoretically, as for me, I can only look at the pocket, out of pocket payment,
Mm,
especially for those who can be able to cover that.
mm,
However, when we look at the other models like NGOs, run facilities, and then the insurance issues, those ones, once that program has gone to an end, maybe the NGO has done with its project, definitely that facility run by that NGO might come down. And so sustainability at that line will be down.
okay.
So, like for me,
Mm,
I look as if our own health system financing still is not sustainable if we rely mostly on these methods that we are now
okay. Thank you. Uh, Zama.
going through. That is according to me.
All right. Thank you. Yes, Zama, you put your hand up. You can unmute and then
Uh,
speak.
yeah,
So,
actually, to my own understanding,
Mm,
and to how I see
mm,
um, the vulnerabilities of financing in South Sudan, uh, most of the hospitals being run by NGO, for example, here for us in Yambio, in Zara, we have one of the biggest hospital being
mm,
operated by, it's being run by missionary sisters. And then
mm,
when you go there, yeah, when you go there, some
mm,
services are given for free. Some
mm,
services are given for free. Then, but there are whereby you are given money. Sometimes they charge you. Maybe they may charge you for bed.
mm,
For bed, how many days you're going to spend there? They charge you per day. I mean per night. Then you look
mm,
at this. Those people who are being charged, sometimes they are. You see them vulnerable. They are unable to pay this money.
mm,
So, but these things being run by NGOs, sometimes you get surprised.
mm,
So it's a little bit, yeah, it's a little bit harder actually for such
mm.
things to be happening. Mm.
Okay, thank you very much. Yes, then you.
Yes, I want to comment on.
healthcare financings
mm,
uh, in the countries. Here, especially in United States, the services provided are actually free because most of the healthcare facilities they are run by NGOs.
mm,
Uh, so when patients go to the health facility, they get the services they are free. But some hospitals or some PCCs that are run by the state Ministry of Health, you find they say the services is free, but at times they lack like drugs. So a patient has to go and buy the drugs if a prescription is given. So they have to pull something out of their pocket to go and buy the drugs, or sometimes bandage, or
mm.
syringes, or needles. So it means it is like a portion of the healthcare services are handled by NGOs and are given free, but the services are rendered by the governments are somehow not free. So the patient has to do something, pull something out of his or her pocket to pay for the services. Thank you.
All right, thank you very much for those contributions, the three of you. Yes, if we rely on donations, it is not very sustainable. What has to happen is that the government needs to uh, have investments that will generate revenues that can be used to finance the health system. Okay, that is the only major way in which we can achieve financial sustainability in financing the health system. Okay, so it's very important that actually in the context of South Sudan, uh, peace is number one. If you don't have peace, then financial achieving financial sustainability is extremely very hard, because if people are peaceful, they can cultivate, they can do whatever businesses they can be involved in, and then you can be able to tax them as the government, and then have what we call the non-oil revenues. At the moment, I think the country relies a lot on oil revenues. So we need to diversify the economy, okay, and such that we have revenues, considerable or significant revenues from non from what we call the non-oil resources or revenues. That is when now we can be able to be moving closer to financial sustainability. So that means that relying on donations, which you do not have guarantee whether they will come or not, and you may not have um, the the authority to define or to decide on how we will use these donations, because donations also come with their own terms and conditions. So clearly, we have a lot of challenging issues in the health financing sector. There's lack of a clear vision and plan for financing the health sector. You need to sit down as a country and know that this is where we want to be and this is how we are going to achieve this. Well, without that strategic vision and plan, it is going to be very hard. We don't have enough data that we can really use as evidence for the appropriate financing mechanism that can work for us. Different countries have different financing mechanisms. Others have the government is then covering each and everything. Others have the government together with the private actors. So different countries have different ways of financing health systems. for us to define the most appropriate health financing system or mechanism, we need to have enough data or evidence. The other issue is that we have not invested in what we call social determinants of health. We have not invested much. This is very, very, very key. What are the drivers of ill health? The drivers of ill health, or what are those conditions that contribute to ill health or diseases? If you understand these factors, then you'll be able to design interventions that can be able to address the social determinants of health. At the moment, we have not yet done that. And then the other one is if you have a lot of people paying money out of their pockets when they become sick, that is a very big problem, because you are sending them to being poor. So the poor people, the low income individuals or families, already they don't have money, and then they get someone with hypertension, and then with hypertension the person has to take drugs for the rest of their lives. So you have directly the family is poor, but again you have sent it to more problems, more financial problems. So more than 50% of what people spend when they go to the health facilities out of pocket. And then we have a problem where we don't have people collecting money to prepare for their ill health. Okay, we don't have. This is basically point number 5 is basically about insurance. With insurance, you pay some money in advance. You contribute money such that when you become sick, that money is what is obtained and then used to treat you. So we have underdeveloped prepaid health financing mechanisms. So that means that the problems that I've outlined above they need to be sorted. For them to be sorted, there's need to have collaboration between the ministries of finance and health. And now this leads you to understand how the health budget is formulated in South Sudan. The structure or the approach is that the lower health authorities, for example, at the county health departments, they come up with the projections of what they would want, and then this is sent to the state, and then from the state to the National Ministry of Health, and then the National Ministry of Health can now come up with a budget, and then it advises the Ministry of Finance on what resources it requires, and then the Ministry of Finance now goes to Parliament to get the national budget approved. Okay. Now, if after approval of the budget, now the money can be sent to the different ministries, and now can be sent to the Ministry of Health, and then also to the state ministries of health, and then finally to the county health departments. Okay. Now, if the Ministry of Finance and Health don't work together, it is not going to be very easy to achieve the financial goals. The point number 2 is that there should be avenues to increase resources. This is what I've just explained in terms of diversifying the economy. If you only rely on oil revenues, it's going to be very, very, very hard. Remember, we had what we call the reduction in global oil prices, and this is one of the contributors of inflation in the country. from nowhere, the oil prices went down, and South Sudan was relying, or is still actually relying on a lot of revenues from oil. So without an alternative source of revenue becomes extremely very hard. So that's why financing the budget is very, very hard. This is where you have issues of lack of essential drugs in the hospital. This is when you have the civil servants not being paid and things like that. Point number 3, it's very important to work with partners, WHO, UNICEF, and other NGOs. It is very important to work with them in order to address some of these challenges. For example, WHO provides guidelines on how countries can manage their financial, their health financial mechanisms. What policies need to be put in place? How can governments collect money? And how can that money be allocated? That is very, very important. Then the other issue is the issue of having value for money. Value for money is basically efficiency. If you invest money, you need to get outcomes that that could actually be appreciated and even be expected. You don't want to use resources and you don't have optimal outcomes. So get more money, spend it very well. You can have a lot of money, but you don't spend it well. So, for example, we have the US. The US is one of the richest countries in the world. Okay? But its health system, so the health services in the US are extremely expensive. Again, the health outcomes are not better because they spend more on the health sector in the country. I hope you have understood that point. You can have a lot of money as a country, but the way you spend that money is not giving you what you could have expected. So you can have another country which is having little money but knows how to use it and then has better health outcomes compared to yours. So if you compare the US with the other countries of almost equal economic power, the other countries have better health outcomes than the US. So you need more money, yes, but how do you spend it? It's also very important. Always strive to make sure that for investments in health that you make, you have value for money, such that you don't waste resources and then you improve efficiency. So having a financial policy is very important because it allows you to look at the possible sources of income or funds that you can use to finance the health system. But also it helps you answer questions. A policy answers questions on what is the problem, how can we solve the problem, okay? So a policy gives solutions to problems that you have. So the health financing policy answers questions related to how are we going to collect the money to finance the health system? Are we going to make sure that everyone is covered? How are we going to spend this money? Okay? And how do we make sure that people are not affected financially because they have become ill? So those are questions that are answered by the health financing policy. In the health financing policy, you need to make sure that you base the policy on evidence. This is what I had explained earlier on, that you need to know what works better for you. There is a saying that you can go to you let me just use an example. You can see people enjoying, two people are enjoying, maybe they have gone out for a weekend and they are buying drinks, food, whatever they want. So there is a saying that says that don't enjoy like what the other people are enjoying, because for them they could be enjoying their harvest, whereas for you, you are enjoying your seeds. Two things: you have seeds and then harvests. So are you enjoying your seeds, the ones that you would have planted to get bigger things, or you're enjoying your harvest? It is better to enjoy harvest than the seeds. Okay, so it means that you need to understand your system, your health system very well, and then you can decide on how you can use the resources. Okay, so that is what basically the point of evidence. You need to have evidence for you to make health policies that suit your context. It is very, 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 very important. It is very important, okay, for you to look at that. Now, we have countries that spend less than 15% of their national budget to health. So, for example, in South Sudan, the national budget for health has been either between 2 to 8% of the national budget. So that means that let me give you an example. If the national budget is 15 million US dollars, that's the national budget, and then on health you spend only 2% of that, you realize that it will be little money that you're going to spend on the health sector. So we have what we call the Abuja Declaration, which was a commitment that at least the national budget, 15% of the national budget, should be committed to health. However, we have very few countries that have been able to meet this commitment. The other issues that are also very important are the issues of child and maternal health. It is very important to spend resources in child and maternal health, because this is a very critical group. Okay, so it is very important that substantial part of the budget is allocated to health. In most cases, most African countries have spent a lot of money, or their budgets actually go for security and what we call the classified budget. Classified budget is usually a budget that goes to security issues. Okay, so that is an area that needs to be explored. So Sub-Saharan Africa generally is spending little money on health compared to other regions in the world. If the process of budgeting, you can say that we are going to spend this amount of money per person per year. But in 2017, 51% of the 53 countries, Sub-Saharan Africa, spent less than $50 per person on health. Okay? And usually there is over-reliance on external donations. It's one of the biggest problems. It's not only in South Sudan alone. Also other Sub-Saharan African countries are facing the same issue. Okay? But generally much of the money comes from the national budget, and then the private sources, people who are paying out of their pocket, or private actors provide 50%, and then donations constitute 20%. But in the context of South Sudan, the donations are more. Okay, we have a lot of NGOs contributing towards the health sector. But the challenge is, of course, sustainability issues, but also issues to do with equity. Where are these organizations located, and where are they spending more money? It's another question that we need to answer, such that we are able to know that, you see, the NGO sector is helping South Sudan, and this is where the money is going. At the moment, it's hard to know. Okay, so donations are very crucial, but that does not only mean that there are no other sources. We also have people, what you call the government partners, who assist. We also have people, actually the private people, remitting money. Okay, those who have parents or relatives in the US, in Norway, in Sweden, in Australia, we have what you call remittances. These people send money so that their relatives in South Sudan can be treated. We can classify that under private sources. Okay, so it is very important that countries start to look at the alternatives of funding apart from the usual ones that you know. Unique alternative sources of income to finance the health system have been employed in different countries. We have countries that have employed what we call airline levy, which is that every time you get a ticket, let us say to move from South Sudan to Kenya, if you pay $100 for that ticket, $5 is going to be taken from that 100, and then that $5 will be sent to finance a health program, for example, HIV treatment. Okay, so that is a unique way of generating money. Others have used levying alcohol and tobacco, because you see, alcohol and tobacco contribute a lot to diseases. So you want to increase taxes on these things such that people move away from alcohol and tobacco. So the money that you have collected out of these taxes can now be used to develop the health sector. Or every time you make a phone call, your airtime can be charged, and then that money goes for the health sector. And then taxes on remittances, what I've just explained earlier on. Okay, if you have a relative who sends $100 to you, then maybe $7 will have to be removed from you and taken to. And then tourism tax. So that are taxes. So you have a lot of other sources. It's basically looking at outside the box of the usual taxes that people pay. Okay. Another mechanism that is actually very, very important is we have what you call dormant funds. You can have assets that are unclaimed, and then you can also use that as one way of financing health system. Then we have what we call social health insurance, okay, where people who are working, they pay taxes that can be used to cater for their health needs if they become sick. So it can be mandatory that the moment you enter into the work sector, the working class, then payments will have to be deducted from your pay, or taxes have to be deducted from your pay. All right, thank you very much for listening. If you have any questions,